The instruments that I would recommend for wound closure are the most basic instruments you need for closing a wound. So we're talking a comfortable sized needle holder. We're talking forceps that are toothed, finely toothed and coarsely toothed, depending on where you are operating on the patient. And also, of course, the scissors that you use to cut your sutures with, as well as using the scissors to cut tissue with, are all important to be nicely made instruments that you are comfortable handling, sterile and easily accessible. And so when you are doing a procedure, you know exactly which instrument you have there and then to help you do your work. If you are doing wound closures in a little bit more of a complex fashion that involves flaps, for instance, then a so-called skin hook should be an accessory which you can access for use during that procedure time. But really, instruments go hand in hand with where you're operating and what you're comfortable using. Some people use needle holders that have a cutting component to it. I don't, but it's all individual training and individual habits. So I suppose in summary, it's a matter of using instruments that can help you hold a needle properly, a matter of using instruments that can cut tissue properly, and also using forceps instruments to augment your procedure and finely tune your procedure in terms of placement of sutures and so on.